Please put your hands together for the CEO, Andy Mears.
Thank you very much, Zoe, and thank you very much to Turner Pope for the opportunity to present this evening. So, my name is Andy Mears. I am Chief Executive of Deltex Medical. So, Deltex Medical is a medtech SME. We're on AIM, as Zoe mentioned. So, our primary product is looking at hemodynamic monitoring. So, we use ultrasound to measure circulating blood volume in the patient. So we have a medical device and we have a single patient use device. So we have a single patient device and the monitor itself. So the ultrasound probe looks like that. So one place in every single patient, ultrasound crystals here, and we measure descending aortic blood flow. Is this too loud? Okay. So when you look at the screen here, what you're seeing is left ventricular output. So the probe is placed into the patient and we are measuring descending aortic blood volume. So, very important from a hemodynamic perspective, we measure the patient's blood flow, we also measure their pressure, and we can measure their resistance. So we have a complete view of the patient during both surgery and in intensive care. So, it's very important to optimize the circulation during surgery. Historically, what the doctor will do, he will use blood pressure or urine output to guess how much fluid the patient needs. So traditionally what happens is the patient will either receive too much or too little fluid during surgery, which causes complications after the surgery. So we have 21 randomized controlled trials showing outcome benefit. So reducing complications after surgery, which then leads to lower hospital stays, improved outcomes, and obviously a lower healthcare spend. We make a range of technologies. The main device that we focus on is the esophageal Doppler, but this is used primarily in the sedated or the anaesthetized patient. So we also now have a range of devices that can be used on an awake patient. The probe itself is very high margin for us. So we focus primarily on selling into the UK and into the USA, so we're direct in both of those markets, and elsewhere around the world we use distribution. So the evidence base that we have now is clearly demonstrating that there is an issue during surgery and after surgery if the doctor gets the amount of fluid given to the patient incorrect. So they give too much, they give too little. What essentially happens is that you give your patient a complication after surgery. So these are avoidable complications. If they use the technology, the patient won't have the technology after surgery. So we're focusing very much on the patient safety story. So we've recently presented our results. We look at last year. I'll come back to the revenues in a moment, but revenues dropped from 5.9 to 5 million, with an operating loss of 0.9 versus last year of 1.9. This part here in H2 is important for us because for Deltex it was a strategy change for us, which I will cover in the slides earlier on. But this is the first time that we've reported a profit in H2 and a reasonable profit in Q4. Q4 is traditionally our strongest quarter of each year, but that generated a profit for us in H2 and generating cash. So cash in the bank at the end of December was 0.6 million. So what happened? What happened in H2? Deltex had a change of strategy. I replaced the existing chief exec. So I was previously the managing director of Deltex, and we had to refocus the company. So we downsized the company. The company had been losing money. So primarily our focus market is the US. We really focus quite heavily on the US because it's the highest margin selling of all of our distribution and direct sales areas. So really downsizing the US team. At one point we had 20 employees in the US, and we downsized to 9. That really helped the US business now to generate cash. We've invested quite heavily at the front of the curve. So now it's really a case of stabilising the business and getting the US business to generate cash back into the UK operation. So when we look at the P&L, this is for the whole of last year. So we look at the probe revenues for 2018. So the probe revenues being primarily this is our core product. So we had that drop. When you look across the year, the key is here, the change in strategy in H2. So significantly reducing both our admin costs and our sales and distribution costs. So we moved from where we were in 2017 with losses of sort of 1.2 million on the EBITDA level, and we dropped that to 0.718. So this is where it gets interesting from the H2 comparisons. So here's our 2018 number versus our 2017. And we've taken $1 million out of our sales and distribution. So where we've traditionally been losing that money, we've now turned it around. So H2 we had an EBITDA of 225 versus a loss last year of 572, and that very small operating profit, which is the first time Deltex has had an operating profit for many, many years. So just going through the balance sheet here, key there is we have cash in the bank. Our balance sheet is very clean, primarily because we only make one specific product and product range around hemodynamic monitoring. And so this new strategy, primarily change in chief exec, I took over in June. We've resized the business to a more appropriate size for the cash. And we've seen those operation costs coming down significantly. So what we're currently doing now, we've had 6 months of that restructuring, is really making sure that the business, especially in the US, is well positioned to start to grow again, which will be the next start of the company's business. Here we just focus on our Q4. I talk about the fact that Q4 is our strongest period of the year. So we sell into distribution primarily at the end of the year, so this is always stronger. But here you can see how the changes in structure and strategy are beginning to pay off. So where we were in 2017 with revenues of 1.9 million in our last quarter, and that's dropped by 300,000 to 1.6. We can actually then see here is this overheads, this significant reduction in overheads. So 1.7 versus 822. And then we can see again we had an operating profit of 422 versus a loss last year, and we generated cash. So we have really looked closely at every single aspect within Deltex Medical. Myself and the finance director have been literally through every single line. We've reduced the costs. My background in the company, I joined the company 30 years ago, so I know the business very well, I know the people very well. So in restructuring, we've made sure that we absolutely have all the people in the right place, and so we can really focus on now moving the business forward. So one of the key areas for us that we're focusing on is this patient safety story. So this will drive the market forward, especially in the US. So there are multiple different complications that can be caused if you get the fluids wrong during surgery, things like acute kidney injury, surgical site infections. Hospitals in the US are penalised a lot of money if their patients have high rates of these infections. So we're really focusing around that patient safety story, and especially around the fact that these are avoidable complications. If the anaesthetist does his job correctly using our device, then he can see a significant reduction in these post-operative complications. So one of the big studies for us that was very important was our 21st randomised controlled trial that was published in the BGA in April in 2018. It's called the Fedora study. The Fedora study is a really interesting study for us. This was a Spanish government study. They looked at the work that we've been doing in the UK. We have a nice recommendation specifically on our technology in the UK. And they said, okay, from a Spanish point of view, does this work on our patients? We see this a lot. Wherever we go around the world, every patient is different. So the country likes to run its own study, its own trial. So the Fedora study primarily looked at low to medium risk. So our previous 21 randomised controlled trials have been based on the high-risk patient. If you use our technology in the high-risk patient, you see a reduction in those post-operative complications. With Fedora, they really said, okay, can we take that to the next level? can we look at really treating the low to medium risk patient? So this is a large randomised controlled trial across 5 university hospitals in Spain. And when you're looking here at the data, you have this GDHT, which stands for goal-directed hemodynamic therapy, and the control group, which is a very well-controlled surgical comparison group. And when you see the complications here down the side, this is stroke, a kidney injury, ARDS, which is acute respiratory distress. Then you have things like arrhythmia, surgical site infections. So when I mentioned earlier on, especially in the US, the patient safety story is around acute kidney injury and surgical site infections. Here you can see acute kidney injury in the Doppler group. There was only 3 patients versus in the control group there were 18. Similar numbers with the ARDS, so 1 versus 12. Surgical site infections, 2 in the Doppler group, 10 in the control. And these really deep, nasty surgical site infections, 4 versus 17. And this is really common sense. If your patient is properly hemodynamically optimised during surgery, then they're going to have less complications because oxygen is being delivered to all the vital organs. So really, this doesn't come as a surprise to us. It comes as a surprise to a lot of doctors because when they're treating their patient, most doctors absolutely believe that when the patient leaves the operating room, they're in good shape. They don't see the kind of complications that happen downstream. So it's really emphasising these are completely avoidable. And in this group of young, fit and healthy patients, where doctors primarily think they can do really whatever they want to from a hemodynamic status point, and the patient will bounce back after surgery, this absolutely shows that's not true. So here it just shows there was a 75% reduction in total complications between the 2 groups, and there were also around about 50% reduction across all of the group. So these are young, fit, healthy patients that shouldn't be having this type of complications. So what's the outlook for Deltex Medical? It's really now to focus on, continue to grow the business. It's a resized business. We're now beginning to generate our own money. We have a fantastic evidence base that clearly shows a reduction in complications across 21 randomised controlled trials. And these, again, are really these avoidable complications. So, where do I stand today, having presented the results? From a 2018 perspective, we went through a year of change at Deltex. We've resized the business. We've taken the business from cash loss to now generating profits. We're in that stage at the moment where we are just really resizing the business, making sure all of the resources are in the right place. As we move through the rest of the year, then we will start to grow from that new base. So, thank you very much.
Thank you very much, Andy.
Thanks, Andy. You refer to it as the gold standard.
Yes.
How much more expensive is it than alternative monitoring methods? And therefore, what's the sort of barrier to sales in terms of cost differential?
That's a good question. Within the areas, sorry, I'm feeding back. Within our competitive field, there are probably maybe 7 or 8 different companies looking at hemodynamic monitoring, and they use a range of different technologies. So we primarily measure centrally using ultrasound. They can use peripheral using blood pressure. The market leader is a company called Edwards Lifescience. So in the US, they have made billions from what's called the pulmonary artery catheter, which is a very invasive technology, very highly reimbursed in the US. So for them, they have a legacy product that's still really generating a lot of money for them. So they're investing heavily in the less invasive technologies moving forward. So from a competitive pricing issue, we're all around about the same level. What Deltex has is we have the evidence base. The other technologies haven't really created that evidence base, especially within the surgical field. Now, I'm really keen, and I'm glad Edwards are in the market, because the biggest barrier to all of us is the fact of educating and changing the doctor's perception of what they're doing. We sell essentially to the wrong person. The anaesthetist, the person who anaesthetises you, puts you to sleep, is the one that uses the device. When the patient leaves the room alive, he's done his job, fantastic. He doesn't see the downstream issues. So it's really the surgeon that sees those. But of course, anytime we talk to the surgeon, he says, well, you need to talk to the anaesthetist. So Edwards are investing a huge amount of money in both the surgical and the anaesthetist on really that education piece. So that's kind of how the market will open up. Deltex, we're a small company, we don't have that kind of marketing reach. So we do need the player, which is Edwards Life Science in that market, really pushing.
Thank you for the presentation. I'm new to your company, so forgive me for some basic questions. What's the growth of your core market? Your revenue shrank, you explained why, but what is the growth of the industry?
The industry as a whole.
Yes, and for your segment. So what kind of growth can we expect as investors, providing that you successfully complete your restructuring?
So the challenge for the marketplace with all of the competing companies at the moment is probably globally there's less than probably 6 or 7% of the market that's been penetrated. So there's an absolutely huge number of patients that currently go through surgery that have no form of hemodynamic monitoring. So the growth of a company like Edwards is probably quite strong. As I presented here, we've just gone through a year where we've seen negative growth, primarily because we've sacrificed some of our sales to take the company from cash negative into that cash positive generation period.
You showed, thank you, Q4 cash generation. Is this something we can assume going forward? Do you expect that to improve? You have 1 million of debt I saw in your balance sheet. Is it to the management? How does management own in a company? What percentage of equity?
So management of the company is quite small. The debt you refer to is a convertible loan note. The majority of shares held are through investment, and our chairman holds probably the largest stake in the company. He's around about 13%.
Thank you.
Thank you, Andy. In the Fedora study, how was the control group monitored for their fluids?
So the hospitals running the study in Spain, they will run under what's called an enhanced recovery protocol. So the lead in that enhanced recovery is taking evidence-based pathways and using them across the whole patient pathway through the hospital. So they were very well controlled with the current practice in Spain and probably around the world. So this is using a algorithm based on the patient's age, weight and height, and they will look at you and say, you need 3 or 5 or 10 mils per kilo. One of the interesting areas, unfortunately, around the world is every single protocol is different. If you go to any hospital around the UK, most of them are near enough in line. As soon as you go into another country, they will use a different algorithm completely. So some countries can be very fluid restrictive, and you'll walk in and they will say 3 mils per kilo for you during surgery, and you can go to somewhere where the US, where they're much more liberal, and they will give you 17 mils per kilo. And this is without monitoring at all, so you're just getting that fluid during the operation regardless.
Andy, you mentioned that you had some less invasive probes. Where are they inserted in the body, and are they shorter, similar length to that, or?
So the other generation are electrodes, so like ECG tabs. So they're placed on the body, and we just focus primarily on that awake patient. So there are some limitations. The evidence base is not particularly strong in that area either. So what we do is we really focus on our core product during the surgery. What we have done by generating this marketplace is that we've kind of emphasized to those people who understand now that they should be monitoring the fluid not just during the surgery but before and after, is giving them another technology that they can follow that patient all the way through.
Thank you very much, Andy. Andy Mears of Deltex.
Thank you.